overlooking almost 9 subjects. So there are bound to be certain little mistakes. So please overlook the little things which you can correct yourselves. Yes? And as it is, the curriculum is in a dynamic phase right now. And in any suggestions from all of you are more than welcome. And we will definitely forward them to the core committee and we'll see what we can do about it. Another very important thing that we should not forget, we need to form a group. So can we share our numbers and form a group on WhatsApp so that we can remain in touch? And the PPT that I'm presenting right here, I will share it in the group. Any doubts that you people have, we can interact through the group. Yeah? So should we circulate a sheet of paper or something so that everybody writes down?
Yeah, sheet is taken. So what we do, we form a group.
Okay. So the mobile numbers are there?
Yeah, all mobile numbers are there and you have to be there.
Great. So we'll form a group for the Maharashtra and the Goa zone. We did the same for the central and the northern zone, for the east zone and the south zone as well. So we'll just form a group so that we remain in touch. And as of now, okay, so how many people here did their, okay, the guy has not come as yet, I can't change the slide. Okay, so how many did their MD in the first decade of the 21st century? The early 2000s? The early 2000s we did our MD during the first decade of, 2000, yes. And how many are MD guides or PhD supervisors today? MD guides or PhD supervisors? Nonetheless, anyways, no, but the subject in which you've done your MD, anyways, as per the new regulations, you can't, but if you did become a guide at an earlier point of time, that's a different thing. But well, okay, so maybe we must be seeing or going through the MD dissertation work that is going on nowadays. Yes? So the difference, I'm only trying to put forth the difference in the work that was done earlier and the work that is being done now, the statistical analysis that has been added to the dissertation work, just to make it authentic. That is the point, right? So that kind of an upgradation is required to the curriculum as well. Yes? Just to make it authentic. We are not here to teach each other how to teach. See, people are sitting with decades of experience and we all know, as in all of you know, and please. Sorry I began with the session, I'm so sorry. Please. So we all have decades of experience and we all know how to teach. Probably in the middle of the night, if we wake you up, anybody wakes you up and asks you, say define APH, say define placenta previa, say define prolapse. You'll be able to say it like the back of your hand, right? But this is the position where we aim to bring the student. This is the position that the student should be in. Because somehow, somewhere during the past years, we have failed to produce enough competent homeopaths who actually believe in homeopathy. That is most important. So what you will see mostly in this curriculum, it's the same. The course that we were following in 2nd BHMS earlier, it's the same. Only the homeopathic part has been added to it, the Hamiltonian classification of disease. Have you people gone through the curriculum that has been shared in the colleges? Yes? I would suggest that you read it again and again. Reading itself will bring clarity to you. It is quite a self-explanatory document. And most of the work has been done for us. Most of the work. Like initially we were sitting with the hours, deciding how many hours we want to give to which topic. Now it is done. The hours are decided. For which topic, how many hours we are supposed to depute. Correct? That is already done for us. The new thing that has come up already, the lesson plan has been discontinued. Anybody who was working with CBDC in the first year? First year CBDC? Anybody who was working with the, did I see your hand up there? No? How do I change the slides? Just tell me. Pendrive से वहीं से मैंने किया माउस है other names. So there are umpteen number of such levels and taxonomies, but Munir sir has simplified it for us, and we are using only 3 of them. One is Miller's, one is Bloom's, and one is Gilbert's. Just 3 of them we are using. And I will simplify it even more for you, since morning you've been listening to this word learner-centric, correct? The curriculum is completely learner-centric. So the only aim of the curriculum is to take the student from being a novice to making him or her an expert. That is all that we have to do. So the 3 levels that you will keep coming up with again and again, the 3 levels are only about the base level, the beginner level which we are calling it, right? That is when the student is at the beginning stage, right? That is the beginner level. The next is the intermediate level, and last is the expert level. Yes? When we talk about Bloom's taxonomy, at the Bloom's taxonomy, there are 3 domains. One is cognitive, one is affective, and one is psychomotor. So cognitive is everything about theory, what the student is learning in theory. So the cognitive level, cognitive domain is divided into 3 Gilbert's levels. The first level is where the student can remember and recall, theoretically. Remember and recall. The second stage is where the student can understand and interpret. Understand and interpret. And the third stage is where there is complete internalization and the student becomes an expert. Alright, putting all these things aside, the Millers, the Blooms, the Gilberts, these are not to be used anywhere in your departmental work. They are not to be used anywhere. These are just for your awareness. You should know about them, what they are. Even if you don't know about them, you will be able to work with the CBDC. Yes? But, of course, as sir said, as teachers also we need to evolve. So we need to know about it, because that is the call of the day. Chala? Need of the hour. How do I go back? Hold on, you put the first page and I will keep going. Yes.
Just select the mouse bar.
Thank you.
You will go to the next page.
Left click se previous, right click se next.
If you want to go to the previous page, right click, then previous page is open. And just select two, next page is open.
So when we go to the beginning, starting, yes, first page. Done, perfect. किया एक ही स्लाइड का चला या दो चला गया All right, so what is education? A continuous process which has achieved goal to bring about desirable changes in the behavior of learners on a relatively permanent basis. That is why the program of assessment that has been included in this is in order to make the change permanent. Because even if we have a backlog, yes, we lose interest in the work. If we have a backlog, we lose interest in our work. So the aim of frequent assessment is to remove that backlog. The student should not have that backlog. That is the point of repetitive assessment for the student. So knowledge, skills and attitude, these are the 3 things that we need to improve in the student. And the 3, just like the Ken's 3-legged stool, the 3 legs upon which the whole CBDC, the whole curriculum is depending upon, the 3 legs are, as sir said in the morning, did anybody take note of it? In the morning, what did sir say? The 3 things, the 3 key features. SLO, TLMM, assessment. SLO, TLMM, assessment. See the Millers, the Blooms and the Gilberts, even if we don't know about, it's not an issue. But these 3 basic rules we should know about. The SLOs. The SLOs are nothing but just, if I enter the class today and I enter with the intention we were maintaining a teaching program in which we mentioned the hours that we are going to give to a particular topic. We were maintaining an ATP in which we were mentioning the dates on which we will cover the particular topic. That is what we were doing. We were maintaining the interactions, the seminars, the tutorials. That's all that we were doing. So we are doing the same thing here. The focus now shifts from theoretical to clinical. So you will also note as we will go ahead, the formative assessments are all practical exams. There is no theoretical exam throughout the year. Even in second BHMS, even in third BHMS. We will discuss a little about third BHMS also because I guess this is the last meeting that we are going to have. We are not going to have any other meeting after this, so we can only remain connected to the WhatsApp group that we formed. And I will give you an idea of the third BHMS as well. The main thing that you need to understand is the competency table which sir already explained in the morning. So let's skip to the good part. This is traditional versus competency based. I think sir elaborated upon it in the morning session. Yes, that was time based. Now the competency based is outcome based. Yes, the outcome is important. That is why you must have noticed at the beginning of every lecture or at the beginning of every PPT, sir stated what objectives will be needed at the end of the session. Right? That is what we have to do. Before we start our lecture, we have to be sure of what achievements we will have by the end of the lecture. Earlier this was all being stated in the lesson plan, but now the lesson plan has been discontinued. Anybody aware of the lesson plan? Yes, lesson plan. So we are not, the lesson plan is now totally your wish. It is absolutely up to your jurisdiction, whether you want to maintain it or not. But as per the directions received from President Sir, the lesson plan has been discontinued. It is not to be maintained. Yes?
Will not be asked for QCI yet on that.
That also sir has said that QCI will be requested or instructed or however that the lesson plan should not be included in the assessment. But yes, for now those are the instructions that we have. So when we make the advanced teaching plan, I feel that instead of writing the chapter, because earlier like it was easy, what we could have done, if a particular topic is given 2 hours, we can mention it on 2 dates. The chapter itself we can mention on 2 dates, and we can attach 2 lesson plans which contain the objectives that we are including in both those hours. Yes? Because you must have gone through the curriculum, you've seen that a particular chapter or a particular topic has been divided into parts. Yes? 1.1, 1.2, 1.3, 1.4. So one chapter can have 10, 12, 15, as many parts, right? That is the breakup of the chapter. Yes? But the breakup is such that if the first topic that we take, there is define gynecology or what is gynecology. So that can't take 1 hour, right? That will not take 1 hour. So you can club 2, 3, 4, 5, the objectives that are coming below that. You can club them and you can put them in one lesson plan for 1 hour. But now the lesson plan is discontinued. So what we can do is, or what we might do, in case if that QCI poses a problem later on, what we can do is, we can club these SLOs and put them in our ATP. Instead of writing the chapter for 2 days, right? Instead of writing the chapter for 2 days, we can put the SLOs over there. Right? What is gynecology? Hahnemannian classification. Just 2 words from each SLO. We can put them in there. But it's totally your wish. If still you feel that you want to continue with the chapter, giving the chapter 2 days, it's up to you. It's up to you. But if you plan your advanced teaching in this manner, it will be easier for you because once you look at your ATP, you will know that this is what I have to go in class and discuss. I have to discuss the definition of gynecology, I have to discuss the Hahnemannian classification. Okay, another thing is the integration. Another new aspect of CBDC is integration. See now, previously how many subjects were there in second year?
4.
Alright. We were teaching from second year onwards. We were teaching patho, correct. The exam going subjects were 4. Yes, exam going subjects were 4, right, in second year. Second year, right? Patho, FMT, MM organ. Exam going subjects were 4, but there were 4 other subjects which did not have exams, but they were included in the timetable. Correct? So we had to take out arts for those subjects as well. Now there is one more subject. Now there are 9 subjects. There are total 9 subjects in second year. Community is not there in second year. Community is not there in second year. Community is from third year. Community is in third and fourth year. Yes? In second year we have only 8 subjects. We have 8 subjects for which we have to chalk out lectures in this time frame. The hours of the college are not going to increase. So in this time frame only we have to complete the lectures allotted to each subject, whether exam going or not exam going. So this integration part comes in where you can utilize one lecture for 2 subjects. That is the purpose of integration. Right? When you have the competency table in front of you, see I have the competency table over here. We come back to these competencies. This is all there, we just discussed all this, the affective and all, the domains and the Gilbert's levels. So this is the macro planning. Let's go to the competency table directly and discuss the competency table itself. Here, the last column, integration, that Sir spoke about. Sir said 12, these 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 columns. These 10 columns Sir discussed in the morning. This is the competency table. This is the first topic in gynecology that we are taking, right? So here comes integration. So when we write Hahnemannian classification of disease, and over here we write integration with organon, this particular lecture can be used as an organon lecture as well as a obs-gynae lecture. So from one lecture we are taking out 2 hours. Yes, because the number of subjects are increased, the number of hours to be given to the subjects are there. So each subject cannot be allotted separate lectures. So such integrative lectures we can incorporate, which we can count in MM as well as in obs-gynae, in pathology as well as in obs-gynae. Yes, if we are dealing with some subject, some topic like say fibroid uterus maybe, so we can discuss it along with pathology and gynae-obs. The integration lies there. Yes, if we are dealing with say female infanticide, feticide, so we can integrate the lecture with FMT. When there is MM, obviously with MM. When there is organon, obviously with organon. So we can integrate the lectures, and that lecture will be counted in both the subjects. So that is the beauty of integration, where our hours, we will not fall short of hours. Yes?
Yeah, I just for integration, 2 staff will be there.
Yes, 2 staff can also take, 1 staff can take half an hour, 1 staff can take half an hour. That is totally up to you. Or sir, the committees that Sir explained, there will be a curriculum committee, a college committee. So those committees are going to interact and decide how the curriculum is to be designed. Yes?
The documents or the whole department, right? The record of that lecture will be.
Yes, of course, because it was an integrated lecture. It was an integrated lecture. Your topic in your ATP will also speak about Hahnemannian classification of disease. That is what you are teaching on that day, and you are integrating that lecture with your organon faculty. So that lecture is being counted in organon as well as in your obs-gynae. Because
when we are keeping the record, we go with.
sorry, one second, ma'am, I'll come to you.
Can we take both the classes, class students and then
We are not integrating the different professional years of students, because right now the second year students that you are dealing with are from CBDC, and the third year that you are dealing with is non-CBDC. Right now the second year that is beginning from the first week of August is CBDC, whereas the third year which is going on currently at our college at least is non-CBDC. So don't think about clubbing them, there's no point clubbing them. That kind of integration that horizontal, one is vertical, and one is spiral. Okay, horizontal integration is when you are integrating with a subject of the same year. But mind you, the staff is integrating and teaching the students. The students are not being integrated. Yes, the staff is integrating and teaching the students such that the student is getting a hang of both the subjects. And then we are counting that particular lecture in both the subjects. Yes, so horizontal integration is when you are integrating in second year Obs-Gynae with pathology, Obs-Gynae with FMT. Vertical integration is when we are integrating Obs-Gynae with anatomy from first year. When we are integrating Obs-Gynae with physiology from first year, we are teaching the menstrual cycle. So we are integrating with physiology. That is vertical integration. And then there is spiral integration. Spiral integration is when the same subject is being taught repetitively in consecutive years. Like repertory, for example, right now is going on from first to fourth year. Although the summative assessment is only in the third year and the fourth year. Repertory is having 2 exams now as per the new curriculum. Final exams are in third year as well as in fourth year. Earlier it was assessed only in fourth year. So now that is spiral integration. When repertory is being taught in second year, it is being integrated with what was taught in first year. So when we teach Obs-Gynae in third year and we integrate with what we taught in second year. For example, we discussed the menstrual cycle in second year, and if we are taking PCOD in the third year, we are integrating with what we taught in Gynae Obs in second year. So that is spiral integration, when the same subject is being repeated. So integration is also of 3 types. Right? That is how it is. So, now, this table is only the main chapter that has been broken down into pieces. It has been broken down into pieces. The objective is written for you. The objective is what? See, if the content is Introduction to Gynaecology, I am teaching it with what objective? That at the end of this session, the student will be able to define gynecology. That is what sir said, verbs. There are all verbs, doing words. Define gynecology, discuss history of gynecology, classify disease according to Hahnemann. These are all verbs. So this is what the student will be able to do at the end of the lecture. Yes? So this is the specific learning objective. And then for teaching this, see the Bloom and Gilbert, you can see C1. So in second year, mostly the student will be at level 1 or 2 only. 3, the student will probably reach by third year. Yes? So here, when you see Bloom or Gilbert, the first one is C1. So what is C1? The first level of cognitive. And what is that? Remember, recall. So the student needs to remember the definition of gynecology. The student needs to be able to define gynecology. That is what the student is doing, correct? So, and that is the objective. Now, for meeting that objective, now this is the priority in between. Priority, you can see MK, NK, DK is the third one. MK is must know. Obviously, if you are teaching Obs and Gynecology, the student must know the definition of gynecology. So this is must know. Yes? Then there is nice to know. See, history of gynecology, discuss the history of gynecology. The priority level is NK. It's nice to know. Even if the student does not know the history of gynecology, it's okay. It's a nice to know thing. Yes? And then between these 2 levels, nice to know and must know, there is desirable. Yes? So these priority levels are designed as per the incidence in the society. These priority levels are decided as per the incidence of the disease or the condition that we are teaching at the global level or at national level. From that, from the incidence we are deciding what the priority is. But if there is a certain disease which is more prevalent, the student should know about it. Right? So it becomes a must-know thing. And if there is a disease which only occurs in say 1% people, so it becomes a desirable to know or a nice to know thing. Yes? Understanding? So the priority level, that is how that is decided. Then the TLMM is all given. TLMM is the teaching, learning, methods and media. The teaching, learning, method and media. What is the difference between method and media? the way of imparting knowledge. Media is the substance or the medium that we are using. Yes? So the blackboard or this projector, these are the medium. Method is lecture only. Method is all lecture only. Yes? So your lecture, small group discussions, these can be kept. So the teaching, learning methods and media in this manner for all of the chapters. This table has been drawn out, so all this has been done already for us. Yes, it's already done. We only have to follow this, that's all. Now for second year, see like there is a lecture or integrated small group discussion or CBL. CBL is a case-based learning. CBL is a case-based learning where we give reference of a case to the student. We narrate a case or maybe we show a case clinically. We take the student and we show the student a case in our OPDs and we show the student a case and that is how the student learns.
Already syllabus is not covered. तो अगर gynaecology की अगर आपको केस दिखानी है, they must know the theory first of all. Then we can show them cases.
Ma'am,
Case based.
मैम होम्योपैथिक लिटरेचर में जब आप होम्योपैथिक केस टेकिंग फीमेल कंप्लेंट्स में डिस्कस कर रहे हैं ना, है ना, और उसमें जब आप और एज पर दी ऑर्गन ऑफ मेडिसिन केस टेकिंग जो करनी है तो उसमें आप स्टूडेंट को ले जाके अपने ओपीडी में खड़ा कर सकते हैं. आप केस टेकिंग कर रहे हैं, है ना. we are doing the case taking, right? Because right now the student is at only C1 level, only C1 na, only C1. So the student will remember and recall what questions you were asking, what you were questioning the patient about. That is what the student will observe. So we can take the student for observation or yes, role play, or we can do it as a role play. In a role play, you can make one student a patient and you can become the physician and others can observe what questions we are asking. So that will be the case-based learning or PBL, a problem-based learning. So there is a problem in front of the student. What questions should the student ask? That is the point here. So that the student at level C1 or C2, the student will only imitate you. The student will only learn from example by just imitating you or by observing you. At C1, C2.
सिलेबस अगर कवर नहीं हुआ, समझो डिस्प्ले एक केस है, सेकंड ईयर में कहाँ है डिस्प्ले? अरे है लेकिन बात में फर्स्ट ऑफ
मैम ये तो हम सिर्फ सिंपल केस टेकिंग की बात कर रहे हैं. केस टेकिंग तो है सेकंड ईयर में.
ओके
केस टेकिंग तो सेकंड ईयर में है, वो तो हमें कराना है. 4 आवर्स है अपने जो अपना प्रैक्टिकल का जो ब्रेकअप है. प्रैक्टिकल में आपको गायनेकोलॉजिकल केस टेकिंग, हाँ सो दिस इज ओनली अबाउट केस टेकिंग. मैम जो टॉपिक का हम बात कर रहे हैं हम उसी में सिर्फ बच्चे को ले रहे हैं, है ना. Rest of the things maybe the child can just observe, but not, you will not question the student on that. You will question the student on the case taking, only on the case taking. The format, the proforma, what questions in what order the student should ask to the patient. That is what. As per the topic, the content or the SL. That is what we are doing here.
And it is integrated with organ.
Yes, we can integrate it with organ, obviously. That is why in the Gazette, the hours given for clinical classes was 60. If anybody has gone through the Gazette, the hours allotted.
24.
I'm talking about the Gazette. I'm talking about the Gazette. 24 is in CBDC. 24 is 160. Ma'am, please sit down. Please.
In Gazette, knowledge access, madam, she is talking 100 for theory in Gazette.
I'm talking about only the clinical hours. Non-lecture is 60. आप सही कह रहे हैं बिल्कुल. Theory 100, non-lecture 60. So that in the curriculum it is 24 hours. Yes, lecture means, that is what I'm saying. Certain terminologies that we should be aware about. That is the big thing. No other thing here. The certain terminologies that have been added here, like earlier we were writing theory, clinical, practical, tutorial. Now we are writing lectures, non-lectures. So there are 100 lectures and 60 non-lectures as per the Gazette. As per the Gazette. Yes, there were 60 in surgery and obstetrics, and there were 92 in PM. But then there were only 30 non-lectures for organ and MM, which were exam-going subjects in second year. So that is why these PM, surgery Gynae were reduced to 24, and 140 hours that were left, they were distributed equally among MM and organ. So they became 100-100. If you see the curriculum, and that amendment will be made to the Gazette as well. So MM and organ now contain 100 non-lectures, whereas we have 24 non-lectures. So I'm coming back to the integration. Somebody pointed out the integration with organ. Yeah. So yes. So where 100 hours of non-lectures are there for organ or for MM, so the students are going to the OPDs, attending the MM and organ OPDs. So they will be seeing certain female patients over there as well. Gynecological cases, so they can learn case taking from the non-lectures of MM and organ. I'm talking about the integration. So that is why we were reduced to 24, because 24 is sufficient in second year. In third year we have 79. As per the Gazette also, no? 79. 79. We have 79 and I think 110 lectures. 110 lectures and 79 non-lectures. So total 189 in the Gazette. So but in second year we have been reduced to this, because this also comes up as a query later on. So I am clarifying it here that the amendment in the Gazette has been forwarded, and the hours that we are following for second year is 24 non-lectures and 100 lectures.
So we have to follow curriculum only. No, madam?
Yes, ma'am.
Curriculum we have to. Yes?
Yes, ma'am.
24.
We have to follow the curriculum, not the Gazette. Yes, ma'am. Yes, ma'am.
And theory hours?
100. We'll go back. Yes. We can talk to each other. I'm just searching for that page for the macro. Yeah. So the macro planning of the CBDC. The gross division of teaching hours for second BHMS is 100, 50 for gynae and 50 for OBS. That is how the division is. And the teaching hours, non-lectures are 24. And the syllabus is divided into 2 terms. What is this? Then should I take the mic? So it is divided into 2 terms. Term 1 and term 2. I have clubbed the table. The lectures again, the classroom teaching and non-lectures include the practical and the clinical demonstrations. That is the terminology that is coming up now. These are the list of topics. See, first term, second term.
Madam, please go lecture, please.
मैम ये मैंने करिकुलम से ही सब कॉपी पेस्ट किया है. ये आपको करिकुलम में भी मिलेगा और ग्रुप में आई विल शेयर दिस पीपीटी. बट स्टिल इफ यू वांट टू इधर थोड़ा वापस जाना मुश्किल हो रहा है. अरे एक बार और पीछे मैम और पीछे. ये वाला हाँ जी. It is all, everything is written in the curriculum. Once again, I will request everyone to please read the curriculum. Please, I have only drawn a gist from the curriculum and mentioned it here in the PPT. So I will share this PPT as well. But if we just sit and read the curriculum, it will be as simple as the back of our hand. It's not all that difficult. So we are dividing it into 2 terms. But for 2 terms, yes, ma'am. 6 months each. The term is of 6 months each. But if you will sit and calculate the hours allotted for the first 6 months is a little more than the hours allotted to the topics in the next 6 months, because the final university exam is supposed to be held by the 11th month, by the end of the 11th month maybe. First week of the 13th month, the student will be in the next professional year. So the second term will be a little shortened. So what we can do is, the whole curriculum that is there, we can divide it into 9 modules for 9 months. Because as it is, even when we were having exams end of the 11th month. So we can divide the whole syllabi. Please, I think yes, I think we do the math. Please pass. So that everybody can hear this.
I just wanted to ask that whether there are any guidelines for, as it is initially there were 80 lectures, right, for second year, according to the VHS and all.
80 lectures,
So
60
now there are 100, right? So as you were saying that we are supposed to take the integrated lectures, right? So is there any specific guideline? So we actually need to add the number of lectures in our timetable, or we can just integrate and mention these 20 lectures within liaison with other subjects.
So ma'am, the timetable is absolutely up to you. This is, see, planning of the timetable is completely up to the institution, how they are planning it. Whether you want to keep a clear-cut lecture demarcating that yes, this will be integrated with maybe MM on first Thursday, with Organ on second Thursday, with FMT on third Thursday, with Patho on fourth Thursday. Whether you want to do that, so that you can include those lectures in the currently running subjects of the year as well as in your subject. So this planning is completely up to you. Or you just want to, say that there is a lecture and XYZ उस दिन हमने इसको अपने में include कर लिया because they were also teaching Hamiltonian classification in that particular lecture, so we included it in our lecture. That will become a little haphazard because then we will have to follow the ATP of order, right? And they will not mention Hamiltonian classification on every Thursday or every Friday. So once you will put your extra lecture on Wednesday, once you will put it on Friday, correct? That is the problem, yes. As their topic may be in the second term, your topic may be in the first term. So going about it schematically between first, second. So again, that is what I'm saying. It is completely the institution's jurisdiction, how they want to plan their timetable. Yes, ma'am, can I be of help? Please. Yes. That also. Yes, ma'am. Can I be of help? Okay, so the next slide, lectures and non-lectures. Let's go ahead. So this is the term-wise distribution of the topics, and it would be really good for us if we divide the module into 9 modules to be completed in 9 months. Yes, that will be the best way of going about it. I've also clubbed the tables with the first term course and the hours. See, one problem is there which I also came across when I was working with first year CBDC. Now the table for the term division is separate and the table for the hours division is separate. So what we can do is in the term division we can just put down the hours in pencil. So it becomes easy for us. Yeah, it becomes easy for us while we are planning the ATP. It becomes really easy. Yes, in one table we have the hours ahead of the topic, and you just open the document on your computer and you just copy paste the SLOs onto your ATP. This is just the job of the first year, just for 1 year, and then we can successively just keep changing the dates. Once it is set, there is not going to be any problem again. We just need to set the SLOs, the learning objectives, against our ATP, against See, theory, the student knows. The student knows theory. But even if at a Viva, if we go and ask the student, a patient, say we say an example, that a patient of 15 years old presents to you with amenorrhea. The student is unable to decipher whether it is primary or secondary. That simple thing also, although the theory is clear. Theoretically, the student is clear. The student knows the theory part. But here, he or she is not being able to identify on the basis of age, on the basis of menarche appeared or not, secondary sexual characteristics appeared or not, so anatomical hoga or physiological hoga. The student is not able to apply. Are you understanding? So the student is only at level 1 according to us of Gilbert. Just remember and recall. Interpret तो हो ही नहीं रहा है. Second वाला level, the student is not reaching the second level. So that is what is our duty now, to bring the student to that level. As in the morning lecture, Munir sir said, right, only teaching is not our responsibility. The student has to learn as well. Previously, we also gave an example where a little kid brings a dog home and then he tells his friend very proudly that I'm going to teach the dog how to speak in English. So the friend says, okay, I'll come back tomorrow. You teach him, I'll come back tomorrow. The friend comes back tomorrow and then he says, okay, you were supposed to teach English now to your dog. So now he's not talking English. So he said, I was to teach him. Whether he was to learn or not is not my responsibility. I taught him. I did teach him 24 hours, but he didn't learn. What can I do? So that shirking of responsibility is not to be done. It is our responsibility. These are our students. At the end of the day, what we are going with the mindset to teach them that they should be able to reproduce. That is what. So more emphasis on the clinical part. This is the hours distribution for the clinical classes. It's very much there in the curriculum. Okay, so micro planning. That is what we are. Let's go to the table. This is the competency table. We discussed this. See, the TLMM, the teaching, learning methods and media. As and how you feel comfortable with whichever medium you feel comfortable, you can incorporate it in your curriculum. If we do not know about it now, we can Google, we can study, we can read, and when we feel confident about it, we can use it for the student. TLMM, there are various TLMMs, like Sir also said, there is the SCT, there is the KFI. So KFI is what? When we go for a Viva. So if we feel that the students who are coming one after the other, we asked the definition of prolapse and they're not being able to tell us the definition. So that becomes the KFI for us. ये किसी को नहीं आता, कोई तो बताए, कोई बता दे तो उसी का upper hand. That is a sort of KFI. The point where everybody is making mistakes. We are assessing the student at that point. That is a KFI. So these and SCT, the script concordance test. So that is nothing but Sir said, right? If a practitioner has a particular way of managing a case and we are giving the same case to our student, how close is the student to that script, which is by a professional? How close is the student? So there are many other ways. For example, even if we are using direct observation of procedural docs, we are using procedural skills, direct observation of procedural skills. This is nothing but we just ask the student to do an examination. Maybe on a mannequin, maybe not a patient, maybe on a mannequin. Yes, maybe in the skill lab. Yes, we ask the patient to do an examination and we are carrying a checklist. We are carrying a checklist. Now the student, the points that the student should follow while examining, whether it's a mannequin or a dummy or a patient, those points are listed in our checklist and we only have to tick yes or no. Whether the student is standing on the right side or not. When we are beginning with the second year, the first preliminary prerequisite is the student should stand on the right side of the patient. The legs should be, the knees should be flexed in order to relax the abdominal muscles for examining, correct? So, and when we have taught the student We have obviously taught the student these steps and then we are assessing. We are just putting tick on yes, no, we have our checklist. For example, when the PAs will come, ma'am was asking about the assessments. The periodic assessment is only of 20 marks. Okay, so here these, you can pick up, you can choose whichever you feel is fine, whichever you feel or we feel that we are confident in, we will pick up those methods and media. The very basic learning methods in second year. We will elaborate on this in third year. Okay, now assessment. Qualities of assessment service. Now assessment is of two types, formative and summative. So that sir explained in the morning. Summative assessment is where we are giving a result, whether the student is fail or pass. That is the summative assessment. And periodic or formative assessment is where we are not making any such declaration. We are only assessing, because this is transformative teaching. So we are only assessing where the student is failing, and then we are improvising our teaching methods as well as the student's learning capacity. We are judging the student's learning capabilities and then accordingly using the TLMM which is best for this student who is failing at a particular point. So this is the overall scheme of internal assessment. For second year we have internal assessment and the marks of the internal assessment of second year will be added to the summative assessment of third year. At the same time, there will be same set of internal assessment for third year as well. See, all subjects which are having final university exams in second year will not have TT2. But we do not have the final university exam in second year, so we have a TT2. In third year, when we will come in third year, Obs Gynae, in third year, this TT2 will convert into a FUE, final university exam. So just these terminologies, little things we need to know. So this TT2 will be converted into a final university exam for us in third year. And for second year, we keep it as a TT2. So there are 2 PAs and 2 TTs in second year. But in third year, we will have 2 PAs, 1 TT and 1 FU. Right? So it's the same. The first PA is at the end of the third month. The first TT is at the end of the 6th month. The second PA is at the end of the 9th month. And then the TT2, which comes at the end of the 11th month or 12th month there. Somewhere in the 11th or 12th month it will be held. The first PA that is held at the end of the third month will include portion only from first to third month. The first TT will include the portion from first to 6th month. The second PA will include the portion from 7th to 9th month only. First to 6th हो गया TT. अभी only 7th to 9th. And then TT2 will have from
they are of 20 marks. And we have 2 periodic examination. The first periodic examination is in between 1 to 3rd one. That is the 3rd one. At the end of 3rd one. Then we revise the first term, that is at the end of 6th month.
Excellent.
Then the second PA2 will be 7 to 9, that is at the 9th month. The syllabus will be 7 to 9, correct? So at 9th month, and then the last one is actually the 11th month first you narrated.
Yes,
It
yes.
is better we convert it to
11th month, it's
okay? That will be T2. And it is overall of 20 marks, which will be included in the practicals of 3rd year. Okay?
Overall internal assessment is of 20 marks.
Internal assessment.
Overall internal assessment is of 20 marks. But each PA is of 20 marks. Each TT is of 100 marks.
Yes.
Yes. And when the final university, actually it is the 12th month because when the final university exam commences for other subjects, yes, they will start with their theoretical exam, the theory, by the end of the 11th week. That is when they will start with that. And once they get over with the theories, their practicals will begin. Correct? So when they are having their practicals for other 4 exam doing subjects, after they finish with that, we can also arrange one TT2 for ourselves, one practical exam for ourselves, for our subject. That is the correct timing, so that they are also, they don't have the burden of the main exams for which they are giving the FUT. And once they finish with that, we can arrange our exam. See, the point of giving these exams marks and including them in 3rd year is so that the student gives weightage to our subject. Because mostly, I don't know what you people have faced. Ma'am, please sit down. Ma'am, please sit down. Yes.
For us to make heavy exams also.
There is no theory exam. No theory exam. There is no theory exam. There is absolutely no theory exam throughout the year. There is only a final university exam in 3rd year. And see the 1 hour. See when we had the lesson plan, we were planning the 1 hour that we have in class. So the 1 hour that we have in class, in that we teach, see even the attention span like sir said today. Initially it was of 20 minutes. Now it has been reduced to 3 minutes. Yes. So we can have bus sessions every 3 minutes. We can have bus sessions in the class every 3 minutes. Just kind of a wake-up call for the students so that all those who've fallen asleep, they can just wake up and follow what is being done in the class. So we can have such discussions and bus sessions so that they don't fall asleep in class. We can quickly ask them, yes, what was the discussion going on? We can give them, see, when we were talking about the lesson plan, there was set induction and entry behavior. Set induction was when we just display, maybe a picture, maybe a chart. Imagine if I'm going to teach what is gynaecology today. So I put up a chart or I put up a picture of the genital organs. Yes? So that it just sets the pace of the lecture and the students start going back to anatomy first year maybe by looking at that picture, and then we can define what is gynaecology. So that was set induction. Yes? So we can do it still, although we are not following the lesson plan. Just because we are not following it doesn't mean that we cannot utilize it in the classroom. We are not writing it down, but we can do it, we can put it in practice in the class. Yes, we can
the end of 6 months. That time, how you are going to assess that clinically?
Yes.
Because the student is at the cognitive level first.
Yes, sir. So we will assess the student only on those parameters, na sir? See,
Because he is going to observe only. He is going to observe how he is going to take a case.
sir, TT1. 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 Sir, the student is observing, but theoretically the student knows what are the points, what are the questions to be asked, what is the format to be maintained when he or she is doing the case taking. So that is what the student is going to do. This is the competency table that we are discussing is only for the lectures. Non-lectures, there are hours deputed. So 4 hours when we are teaching the student gynecological case taking. So then the student does know how to take a gynecological case. That is on what we are going to assess the student. Recording of case in obstetrics and gynecology will be of 20 marks. This is for TT1. The 50 marks that we are saying, 50 marks for oral viva, 50 marks for clinical, practical. So this is the distribution of the 50 marks for the practical in TT1. So that is 20 marks. See, if you think that you have done your obstetric as well as gynecological case taking, then you can give 2 cases for 10 marks each. But if you feel that in this first term I have done only the gynecological case taking with the student elaborately, so we can keep for 20 marks gynecological case taking. This is definitely up to you. This is your perspective as to what you have taught the student. You will assess the student on that basis. Then there will be general physical examination, per abdominal examination, pelvic grips for 15 marks. This TT1 is as per the course that is mentioned in term 1. And then there is, see, lab investigations also, like diagnosis of pregnancy, we would have taught them in the first term. So the lab investigations that they should suggest in the first trimester, second trimester, third trimester, their importance, that they should know. This is all theoretical only, sir. Yes? Then there will be demonstration of the fetal skull and the pelvic diameters for 10 marks that. So this will be the parameters for assessment. Now here, as and how you have taught the student, suppose the pelvic diameters have not been done, only the fetal skull has been done. You can ask for 10 marks, you can ask the fetal skull. We can keep the pelvic diameters for second term. You can do it as and how you have completed your work. And in a similar fashion, 50 marks. Ma'am, 50 marks is separate for one. 50 marks for oral examination is separate. This is only the distribution of 50 marks for the practical exam that we are taking at PT. PA1 is only of 20 marks and that we are doing only like a judge the student only out of 80 marks. And we will add the internal assessment. So oral out of 80, internal out of 20, practical out of 100. That will be the final assessment in third year. Understanding? Okay, so this is clear. Great. This is assessment phase and features of it. This is a template of the calculus that I have made. This can be followed at your institution as and how you wish. This is as per what we follow at our college. So I kept the third lecture, see, because if we are aiming at 100 lectures and we are saying that we have 9 months only. So if we have 3 lectures a week, we get 12 lectures in a month. So that makes approximately 108 lectures in 9 months. So at least we should have 3 lectures in a week. Earlier we were having 2. We had 80 lectures. We were having 2 in a week. Now we need a third one. So third one will come. If it comes as an integrated lecture, it will be better because otherwise then giving hours to all the subjects will get really tough. But this is just a suggestion. This you don't have to follow. You will follow whatever your institutional curriculum committee or your core committee advocates. This is the academic calendar of events for CBDC. For the first working day of August becomes the course commencement. I guess all session 22, batch 22-23 CBDC students have had their exams. Yes, they finished their exams. Result awaited. So, but the session has started. August first week, the session has started. So, 4th week of October is PT1, the periodic test, or PA1, periodic assessment 1. That is the end of the third month. Then there is 4th week of January, PT1. Then 4th week of April, PT2. And 4th week of June is TT2 or FUE. This is as per the month starting from August, which month will fall at 3rd, 6th, 9th, 12th. As per that it has been timed. And then the first working day of August, again commencement of next professional year. We come to 3rd. This is all up to your jurisdiction, your institutions say however they want to follow this. This is just a template that I am sharing. This is nothing mandatory or this only has to be followed. It's a much down south when I went, they have not even had their exams. Their exams will be starting in the last week of August. They have not had their exams for CBDC 22-23 now. So this, sir always advocates. There is my theme table. Oops. There is a theme. I had a theme table, I think. I had to remove the lesson plan and I had to remove the theme table. Okay, when I share this in the group, the question paper pattern you people have understood, sir discussed it in the morning. The question paper pattern is like that only, 10 MCQs, yes, for which each we are giving 1 minute. So 10 minutes for the MCQs. There are 8 SCQs. Yes, ma'am? Student is actually internal assessment. Can I give you the mic, ma'am? Hanji. Student is paid or absent in internal assessment, then please repeat your question, ma'am. Please listen to the question, and I would be more than happy if somebody would please volunteer to answer the question.
If student is absent or failed in second year assessment exam, then if any other
crucial actually. Yes, ma'am. Yes, ma'am. ATKT failed in pathology 2-3 times.
If already a student who is in CBDC first year, if that student failed, whether that student will be ATKT, carry forward to second year or not?
A student has failed first year.
Yeah.
Is there internal assessment तभी का लेना है या फिर internal assessment कैसे करना है? नहीं, internal नहीं होगा.
Already the CBDC student is there. If in that case, student failed in one subject, whether he will be carried forward to second year or not?
Previously we were doing this, the student was carried forward. Now if there is any change in the I will please have to check and then confirm this. Good, a very good question, yes. Okay. बट वो आएगा नहीं मैम और वो आपका होगा नहीं मेंटेन, वो कोई पॉइंट नहीं है. बेस्ट इज कि जब वो पास करे उसके बाद से उसको अपना सेकेंड ईयर कंसिडर करके और वहाँ से करें. बट दिस इज अ वेरी गुड पॉइंट. दिस इज अ वेरी गुड पॉइंट दैट मैम हैज ब्रॉट अप प्लीज. एंड आई थिंक आई विल ऑल्सो फॉरवर्ड दिस एज अ सजेशन टू द कोर कमिटी as to what can be done about those students who are failing in other subjects. Say in first year, CBDC. Abhi students have done up a period for the exam. Now say the student fails in anatomy. Yes. So how do we go about keeping the record for all this in second year? Yes. Because he will be appearing in anatomy and he will not attend second year until unless he passes anatomy. Yes. He won't come ideally. So that also for that examination also one pan-India pattern needs to be created. That is a suggestion that PAN has come up with, and we will definitely put it forward to the core committee and see what can be done about this. Yes, please. And the group that we are forming, please, whatever suggestions there are, please we can share in the group so that I will forward them to the core committee and see what can be done about it. But whatever queries also we have now, we can carry out discussions in the group, not an issue, and we'll stay connected through the group. Meanwhile, the theme table that I was telling you, we were at the question paper pattern. So 10 MCQs, 8 short answer questions, and 5 long answer questions. No options, all compulsory. Just like sir printed out, somehow the slide has gone missing from here. So all compulsory, no options. 10 MCQs for 10 marks to be written in 10 minutes. 8 short answer questions for 5 marks each, matlab 40 marks to be written in 64 minutes, 8 minutes each. And 5 long answers to be written in 15 minutes each for 10 marks. So 50 plus 40 plus 10, 100 marks paper, right? Now in third year, a theme table is going to come up. Okay, theme table, just like we decided the priority of the topic, in a similar fashion we are going to decide which topic can be asked as an MCQ, which can be asked as an SAQ, and which can be asked as an LAQ. So that theme table, referring to that theme table, the question papers need to be set. That, like in theme A, we have clubbed a few topics, and then we are saying from theme A there should be 2 MCQs, 1 SAQ, and 1 LAQ. Then in theme B, we are clubbing a few topics, then 2 here, so that equal distribution is there from all over the course in the question paper. Yes, not just 1 or 2 important topics, but there is equal weightage and equal distribution. A topic which is small needs to be asked as an MCQ, a topic which is large needs to be asked as an LAQ. So that theme table will also come up in the third BHMS curriculum. So that you will understand, there will be a theme table, theme A, particular topics will be assigned, and then there will be a question paper. That will all come up, because now we have
I'm making some.
No ma'am, you will make your own checklist. Otherwise you give your own marks. You only need to keep the
What documentation we have to prove later on?
You just have to form one standard checklist and keep it in the department that this is how we assess.
So is there-
And you maintain the mark sheet of the student. If this student got this many marks, how assessment was done by this checklist. You don't need to maintain individual checklist. If you do, that is good enough. But otherwise, you just need to maintain the format as to how you assess the student. Students' logbook is what we are teaching in class. The student is maintaining notes. What the student is writing a test in class, maybe answering a question in class, maybe that is his personal diary, his or her personal diary that he or she is maintaining for this subject. So we have told our students to bring one spiral thing which has punctuation with colored pages and make 4 subjects cover like that. That is what we have done. You can come up with other ideas. Then there are students who forget to bring the notebook. So what you will do is make them do the job and get it submitted in the department. Because when you need it, they will not bring it. So you make them do the work and get it submitted in the department. Seminar tutorial is your wish. You will carry it out in the lectures only. Separately, there are no seminars and tutorials. Seminar tutorials are now BHMS. They are teaching learning methods which you will incorporate in your curriculum. In the lectures.
Ma'am, do we need to conduct pre-final exams and keep the records of them or not?
Conduct what?
Or not? Pre-final exams or preliminary exams before final university exams? Theory also. Yeah, theory. That is also.
This is what there is now. There is no other exam apart from these 4 exams.
Okay, that means only final theory exams are there, no any written exams are there, only
No,
final.
only these practical and clinical exams that we are taking.
Okay.
These PAs and PTs. This is all that there is. Nothing else.
Syllabus for study
50 marks are practical